What's up? It's Way Up with Angela Yee, and it's that time. We got some really important things to discuss. Coach Jesse is here with me, of course, and we're talking about something that affects so many of us, and this is a topic that Coach Jesse is always bringing to the forefront, and so am I on Way Up, because this affects a lot of Black women in particular, and that is what happens when doctors don't listen. Now, we do have somebody here who has been on it, and on it in the medical world. Her TikTok about patient dismissal went viral. We're going to talk about WWs and all of that.
And TWs.
Right. And yes, and 1.9 million views you got. And then 802,000 on Instagram as a reel. You're a board-certified family physician, a health equity advocate, and the founder of Clinicians Who Care. Dr. Bayo Curry-Winchell is here. Dr. Bayo, welcome to Way Up.
Thank you for having me. I'm excited just to be here in this room. Like the energy, I'm all in.
Listen, I love your energy. And just for backstory on her way here, she had a journey, but she made it.
I sure did.
Yeah.
And I stayed positive. But yes, my Uber driver got into an accident, but I hustled, I got out, and I had some exercise this morning.
Yeah.
So that's wonderful.
And came in here looking like nothing happened.
Right?
Hi, how you doing? But yeah, so we're glad to have you here. And of course, Coach Jesse is the person who brought you to the forefront for me. And you're gonna be talking with us and educating all of us and keeping us all accountable, because that's what Coach Jesse does for me. She is the founder of the detoxnow.com. Coach Jesse.
Yes, ma'am.
Welcome back.
Thank you. I love you.
I love you too. Now, Dr. Bayo, before we get into the solutions that you've come up with, because I feel like it's one thing to talk about problems, but it's another thing when you actually find how do we solve these issues, because we've been talking about a lot of the problems that we have when it comes to our health, right? And so I want people to understand what your story is. You live this not just as a doctor, but also as a patient. So talk to us about what was happening with you and how doctors kept brushing you off.
So the work that I do in this advocacy space, exactly what you said, Angela, people talk about it, but what is the action behind it? And although I've been in this space for a long time, it wasn't until I nearly became a statistic that we hear about all the time, which is Black women are 3 times more likely to die during childbirth or shortly thereafter than our white counterparts. Well, I had just delivered my second baby, and I came out of the C-section, and it was about 30 minutes. I knew I didn't feel right, and I knew it because I was having a hard time concentrating. I was having a hard time talking, and I just felt this level of fatigue that I had not felt 2 years prior with my first baby. Mm-hmm. So as I sat with that, I finally said, I called my nurse and I said, something isn't right. And she said, you look fine, Bayo. Everything looks normal. This is how you're supposed to feel. So I sat with that for a little bit longer, and it started to get worse. So I reached out to her again, and she said, this is completely normal. You are experiencing everything that you should. And I'll never forget, as she exited the room, it started to get worse. I started to feel a pain that I'd never felt in my life. And so I asked my husband to call my doctor, and I was lucky to have the privilege of having his number, thank you, in my phone. And so he called and said, something's wrong with Bayo. My doctor came over, and he knew something wasn't right. And at that point, I could barely articulate what was happening. Next thing I know, I'm sent to the OR. I found that I'm bleeding internally. I'm transfused multiple units of blood. I was hospitalized for weeks. And so in that moment, I nearly lost my life. Wow.
And knowing something was wrong.
I knew something was wrong. And so this work that I do is not only just a part of this, it's personal. Mm-hmm. I want to help as many people as I can, and especially women and Black women, be able to have that voice, because I know what it's like, and I nearly became that statistic. So if I can share my story in hopes that statistic that you hear, you can have an image behind it, because this is a hospital that I work as a physician and a medical director. So the staff knew me for years, but it didn't matter.
Right.
That's so crazy.
And imagine it was somebody who was having their first baby and someone's just telling you this is you're feeling everything that you're supposed to feel and you're like, okay, maybe this is normal, let me just
because you don't have a point of reference.
Yeah, you don't have a point of reference.
And
And then you're also a medical professional, and some people don't know how to advocate for themselves at a time like that because we feel like if our doctor is telling us something, that's just what it is, let me just bear through it.
Exactly. And how many at that moment, I thought, especially during the recovery, how many women who sit through this because there is a power dynamic that exists between doctors and patients, meaning the doctor is supposed to be the know-all that knows all the information and the patient, you're in there, you're vulnerable, you don't feel well, and you're in a state of where you're just waiting to get the information to how can I feel better? And that shouldn't be the case. And that's my love and passion is to flip it, where it is your body, your decision, and that doctor should share with you what things are happening so you can have those answers. But it's a vulnerable state to be in when you don't feel well.
Yeah, I was just sharing with Dr. Bayo how, when I had the brain aneurysm, I was in a very similar position where I went because I had the worst headache of my life. And thank God for a good doctor who told me to go. My nephrologist said, hey, you are a higher risk for a brain aneurysm because of the kidney disease, and sent me for a testing. They actually, the test showed I had a significant brain aneurysm. And then the doctor, after the neurosurgeon, says to me, you have a significant brain aneurysm. And my pain level is through the roof. It's like level 20 pain. And that, as you know, that can escalate your blood pressure. So my blood pressure was at 199. Okay. That's crazy.
That's wild.
Stroke level, right? Yes. And stroke level, and you have an aneurysm. Okay. And the doctor says to me, perfect. I can fit you into my calendar in 8 days. Go home and come back. And like I was telling Dr. Bayo, I was like, if I was not an advocate, I would have just said, okay, because I would have believed the doctor.
Right.
But I knew right away. I said, if I go home like this is going to rupture the aneurysm and I'll have no help and I will die at home.
Yeah, thank goodness you knew.
It's crazy. But how many women went home? And that's when you say you literally feel your life slipping away. And you're fighting for it in that moment,
Well, and I always like to talk about you can be the most educated world traveler, all the things. But when you walk into that exam room, all of a sudden, all of that vanishes.
Right.
Yep.
And you may have had an agenda when you went in there of what you want to say, but all of a sudden when a doctor comes in, it's hard to articulate it. It's hard to get it out. And then if you are met with words like, well, you look fine, your labs look fine, or you're just stressed, that can all of a sudden diminish your concerns where you start to doubt yourself and start to play a different narrative of how you really feel because you don't feel right.
Yeah, you hush the warning signs.
Correct.
Dr. Bayo, you've also kind of pulled back the curtain on what goes on in medical training, which the average person wouldn't know. And so I want you to talk about that a little bit because this was fascinating for me to hear about, but also something that can kind of give some insight onto why sometimes we may be treated like this.
So you saw me smile because it is such a joy to be able to lift that curtain and give people the information I know as a doctor. Because if you can go in there knowing what that doctor knows so you can get the care that you should have always, that I feel for me is what medicine and healthcare should be about. So an example, I talk about the 3 C's, being clear, concise, and confident. How given an example of that, if you are not feeling well and you go to the doctor and you're like, I just haven't been feeling well for a couple of days, that doctor can interpret it in many ways. Right. They can say, oh, you're just anxious, or maybe you just need to sleep more, or maybe you just need to kind of reduce your stress, versus I've been having stomach pain for 3 days. I can't eat. I'm nauseous all the time, and it's impacting my quality of life. All of a sudden, you are being clear, you're being concise, and you are being confident. And I can tell you, when you say it in that way, a doctor who will have a running list, meaning there's a term called differential diagnosis. So based on the symptoms that you present, that doctor will think of 3 to 4 things that your symptoms could be associated with. So that example I gave with stomach pain, the doctor's going to think it could be constipation, it could be gallbladders, it could be stress. But if you give it in the way that I said, all of a sudden it's like, oh, maybe we need to check for cancer. Maybe we need to check for this. So my goal is to, in every area of healthcare, I'm going to give you that language. I'll give you exactly what to say to get to the next step. So that doctor is like, oh no, we need to check this. And then also I go a little bit further. If you are in front of a doctor and they tell you your labs look fine, everything looks normal, this is what I recommend you say. I understand that my labs are normal, but I'm curious. I'm still not feeling well. So what are the next steps to identify why I'm feeling like this?
I love that.
And using the words curious or help me understand is an important piece, because I understand that not everyone feels comfortable. We hear about advocating for yourself and standing up. Yes, but it can be hard. So if I can give you the language that is non-confrontational, that puts it to the doctor in respect to, tell me your decision making. Help me understand your decision making. It helps kind of equal the playing ground.
Yeah, it keeps you on the same team.
Right. It's a partnership versus, why did you do this? Why are you doing this to me? Instead, I'm curious behind your thinking. I'm curious behind the decision making. It changes that narrative.
No, I like when I'm at the doctor and they explain, I tell them that too. I'm like, I really like for you to over-explain everything to me. And I'm always curious, like you said, to know all of the details. Don't just be like, you're fine, but oh, this is what this is your, and just so that I can feel more comfortable in knowing that. And Coach Jessie would be like, well, what are your numbers? Do you have your, and she's like, can you screenshot that and send it to me?
Yes. It's true. It's really helpful. And even, with my patients, let's say if I have a patient that I need to send to a specialist, I will tell her to ask the doctor, okay, if they're going to order labs, if my labs are abnormal, what is the plan? If my labs are normal, what is the plan? Because how many of us have waited for results and you're just like, what's the plan?
I have no idea. What does it mean?
So you can go in there exactly saying, okay, what's the plan? And then it gives you agency to find out, is this doctor on the same playing field as me? Because if they're thinking, we're not going to do anything if these labs are normal, in advance.
It's true.
And that way you can decide, do I stay with this doctor or do I go a different route?
Another thing that I learned on a build on the differentials diagnosis was really important, which was to ask, what are your differential diagnosis for what I'm dealing with? But then also, when they list them out, it's so what evidence do you have that's ruling those other things out, right? Because when you ask that important question, then they actually have to run tests that they could have skipped, right? So, for instance, I shared the story how I have polycystic kidney disease. I've shared this numerous times, and it's a genetic kidney disease where there are cysts all over. And I had a pain right here, which I thought it was a ruptured cyst, right? But given all the surgical history I have, I said, I cannot assume. So I went to the ER and they said, okay, first they did a CT scan to make sure it wasn't an obstruction, because I've had numerous obstructions in, abdominal obstructions from small bowel obstructions. They ruled that out. And they also did a D-dimer test to make sure it wasn't a blood clot, right? Because again, they're looking at what it can be. And I said, all right, so what is the evidence that rules that out? So then they did a test. I think the next one, they ran labs, made sure that there was an enzyme that they tested for, right? Once all of those came back negative, the result was, okay, it must be a ruptured cyst. So then I came back to my nephrologist and he said, okay, if it is a ruptured cyst, the pain will dissipate in 1 to 2 weeks. So I tracked that and then it was gone. So we knew that's what it was. But in cases where, we've spoken about my cousin, in fact, my cousin died of colon cancer a year ago, and he had back pain. That back pain, 35, young, healthy, never sick. But his dad died of pancreatic cancer, right? So when he had back pain, the doctor initially said, oh, it must be from gardening, you pulled something. I said, okay, I can figure that in a week or two. You're talking about months later. And no imaging was done until May. So if he would have said, hey, how do we know that it's just that? like what tests will you run to show and prove that it's not? What are the and I felt so like, wow, we really don't have that language. So thank you so much for sharing that, because it is important to know that they have to rule out the worst cases first.
Yeah.
That is what you want the doctors to do. What's the worst? What's the monster? Let's look at what the monster is, and let's prove that it's not that monster before we start taking, terms.
Your life is literally on the line.
It is.
Literally.
It really is. It is your life. And first, I would just want to say I'm sorry for your loss.
Thank you.
And it makes me think so. I had a patient 5 months ago. I'll just call her Maria. And she had been to 3 doctors before I saw her. And she had been dealing with stomach pain. She was a little nauseous. And she was like, nothing really makes it better. But I do know when I eat, even if I'm just trying to do crackers or ginger ale, it makes it worse. Well, she had been told that she was constipated. Then she was told that it was just like a irritable bowel syndrome. And then that she was stressed. So by the time I saw her, I said, well, do you have any family history of any cancer?
Right.
And she was like, well, my mom had breast cancer, but nothing else. And so as I'm examining her, I said, have you ever had a colonoscopy? She's
My God.
28 years old. And she was like, no one has ever said anything. I was like, we're going to do a colonoscopy.
Good for
She
you.
was diagnosed, I diagnosed her with colon cancer.
That's so
And
pleasant.
that's the thing, like having a doctor not only to share all those differential diagnoses, dig a little bit deeper, but if they don't, having the language of help me understand what else could it be.
Right.
And you have the right to know all of the options available, and then you choose which path you would like to go.
Dr. Bayo, you've gotten like millions of views on TikTok. Just kind of explaining your own experience. Why do you think that hit so hard for people?
I believe it hits hard because I represent what a lot of us are going through. And for me as a doctor, I dance to my own beat. I'm not traditional. I am a doctor who will hug you in my exam room. I will spend extra time. And yes, I do get in trouble, but I don't care. And I've always
She's
done
the
that.
clinician who cares.
And when I do. And when you see me online, I am authentic to the core. I am someone who will share all the things. I share even my mishaps, the things that, things that I wish I could have done better. And I think it resonates with people, and I take great pride in what I put online, because for me, it's not just about content. It is about serving the people who have taken the time to listen to my information. And I take it very seriously, because for me, it's like each person is in that exam room with me.
Right.
So whatever I put out there, I want to make sure you have the best information possible. So wherever your circumstances are, wherever you live, you can advocate and you can stand
It's a
up for
lifeline.
yourself.
Yeah.
What do you think about people using like AI and ChatGPT to diagnose themselves? Because I know nowadays a lot of people are like, well, let me just put it in here and ask and see what's wrong with me. Let me put my symptoms in here. What would you say?
I think it's a great starting point. You just have to make sure that you don't put any personal information. And the other thing is, whatever information you get, have it followed up with a
Right.
doctor.
Right.
Because we can't forget that AI is just perpetuating the inequities and the racial disparities that we already see.
Found that out.
So I've had patients who have put in certain symptoms, and because of what is built in our system as far as not always including people of color with certain diseases, a great example, I had a lady who came in. She was having, she noticed her gait, her walking had changed a little bit, as well as her handwriting. And so it was very small, and she's one that does very beautiful cursive. She put it into AI, and it said, oh, it's because of your age, you're getting older. She's 56 years old. So when she came
young,
in, right?
says a 54-year-old.
Right. But, the interesting part was, and it is young.
Yeah.
It is very
How
young.
dare ChatGPT.
I know.
How dare
I'm like,
ChatGPT.
well, and that shows some of the age bias and all the
Yeah,
things that
'Cause
are
that's
in there.
fairly new.
Right. I'm like, you're still. And so as we're talking, fast forward, I diagnosed her with Parkinson's.
Wow.
And she's a Black woman. And think about what you see when you think of Parkinson's. Do you
Yep,
see
white
someone that
male.
looks like us?
No. Mm-mm.
No. And so AI will perpetuate some of those things because it hasn't been built that look, the
Hasn't been
representation
given that
hasn't
lens.
been right.
But what I have found to be helpful is actually when you give it direction specifically for those inequities, though, but you don't know to look for it. Like, you have to say, well, what is the research specifically on that? So then it has to go looking and digging for it. And when it does dig for it, so you can't just be general. Like, you need to, it's like operating, understanding there are inequities in the system. And because of that, filtering based on that. You know what I mean? But definitely a first step in helping you with your research, even as you go and you work with your physician who cares.
Yes, absolutely. And the other thing is, women, we haven't been studied. I always like to tell people the number. I give it. This is a great example. Women's health has been studied as long as Netflix has been around, which is 30 years.
Right.
Which is
all
ridiculous.
the research has not included women.
Right.
And that's why we need to be in these positions to make sure that research is getting done. That's why we have all the issues.
Yep.
Yeah.
Because they never factor us in, right?
Correct. And that's why some medications, another example, 2 years ago, there was a woman who had fallen asleep at the wheel and she got pulled over. She had taken the medication Ambien. Well, we found out that Ambien, you can't give a woman 10 milligrams, the regular dose, but it hadn't been studied in women. It had only been studied in men. And we
You shouldn't be driving if you take
medication, first of all.
You shouldn't drive on Ambien, period.
Oh, okay, yeah.
She took it, and so it was still in her system.
It was still in her system.
And so now it's recommended a lesser dose.
So that's actually crazy. So after the whole brain aneurysm thing, I developed terrible, because it was also connected to hypoparathyroidism. I'm telling you, this medical speak, right? Hypercalcemia. Hypercalcemia was found, which caused terrible. It was driven by vitamin D deficiency as well, right? Was very severe. I didn't know this at the time. And guess what? It took like a year to get me regulated. So I was dealing with insomnia where nothing helped. Like, the only thing that worked was Ambien, right? So I'm talking to now a sleep specialist who's saying to me, I said, well, I'm down. Things are getting better. I'm down to like a quarter of a pill, right? Because the pill is 10 milligrams. And he's like, that's not working. I'm like, no, I'm telling you, it actually works. Going back to a physician who doesn't, they're like, this is crazy. She doesn't know. I know that
I'm actually doing it.
I'm actually doing it. So if you're down to a quarter, then that's not even giving you an effect. Yeah, no, it's working. So that's like, if you don't have someone, number one, as a woman, it affected my body different. And then as someone who's got the issues I have, I could even use even much less by that point, right? Because I couldn't drive. If I even took half a pill, which was 5 milligrams, I couldn't drive.
And that clinician is going off of data. When he's telling you that, that little amount won't work, he's going off of what has been studied in men, not women. So that, kind of the ongoing disparity or incorrect information happens in exam rooms every day because we haven't been studied.
Well, Dr. Bayo, that brings us to clinicians who care. Yes. I want to get right into that because you created this space. So talk to us about what is Clinicians Who Care.
So over 90% of Americans have shared that they have been dismissed or gaslit when they seek care. And that means being told that you're fine, everything is okay. Well, recently I shared another story of dismissal that happened to me during my third year of medical school in Chicago. I noticed that I started losing my hair. I was dealing with joint pain and my hands and my feet were swollen. Every morning, it didn't matter what I did. And so I went to the doctor and I was told, well, do you think you're pregnant? I was like, no, I don't think I'm pregnant. That's what happened. It's in my record. And then I was told, well, this is normal because you're in medical school and you are just stressed out. So after going to 6 doctors, I finally found one doctor to listen and believe me. And I ultimately ended up with a diagnosis of lupus, and I have a clotting disorder as well. Well, I shared that story online. I had never shared that, even though I share a lot. And when I did, it blew up because people were sharing the names. They were sharing their dismissal, but they were also sharing the name of a doctor who had listened, cared, and believed them. I'll never forget. Powerful. One lady wrote in all caps, it took 42 years to get a diagnosis of ADHD. And then I thought to myself, I know what I'm going to do. I'm going to create a list that connects people with doctors who've been shown to listen, care, and believe their patients. Because if you can find a doctor from the jump that will just listen to you and believe you, it can help set you on the right path. So created my team, a small little team. We created a Google form and we put city and state, and now we have country, and I'll get to that. And then we put every single specialty. So we have OB-GYN, we have orthopedic, cardiology, midwife,
gastroenterology,
pharmacist, GI, all of it. And you write in how that doctor made you feel. It is a patient recommended list. It is organic. I started it just a few months ago, and it
doctors
grew.
aren't putting themselves on there.
Now they could be, but we have vetted, we vet and we can see, and you can see the difference when a patient shares it, but it could happen. But the cool thing is, because you've never seen anything else like that, where I use the best example is, how many of us have called a girlfriend or a friend and said, do you know a name of a doctor that you can trust? Well, this list serves it.
Listen, I had someone on here the other day, a couple, Akeisha Colon and Willie Colon. And she had,
story, right?
Yes, she had several miscarriages before finally, fortunately, having a healthy baby. She had 9, right? 8? Okay, well, she had several miscarriages, and then finally was able to go see a doctor who she talks about in her book, that was listening to her. She felt heard, and she ended up having a healthy baby, followed by another one. And so it really was about the doctor that came through for her and that helped her and was like, all you need is one egg. She had other doctors that was telling her, well, you're going to have to get a donor egg. You're going to have to do this, and she didn't want to go that route. And so finally she found the right doctor. But just to think about like how many women are going through that, and they just don't have and they're getting these suggestions of what they should be doing, or being told, well, that's not going to happen for you. You need to do X, Y, and Z. And then it ended up happening because she went to the right doctor.
Absolutely. It can make a huge difference. Just 3 weeks ago, I received a DM, and a woman said that she had been dismissed for several years. She found an OB-GYN on the list and unfortunately was diagnosed with ovarian cancer. But in the message, she said, thank you, because I found a doctor that took all of my symptoms seriously. Like, that's a message. And then I had a mom who reached out from Connecticut and said, I have a neurodivergent child, and I have been looking for a pediatrician who will take my child and their journey seriously. And it touches my heart, because she said, I found someone on your list. I saw them, and we have a plan. That's healthcare, Angela.
Yes.
And that it touches my heart, because our system is fractured. We know that. But if we can have something that will help us get to the right care sooner rather than later, that's huge.
No, it's phenomenal. Let me tell you, I was telling you in the room, because of the complications from the fibroid surgeries. Remember, I told you this, Angela. I was like, the complications I deal with, the lifelong chronic, they're not from the fibroids. They're from the surgeries. They're from the complications from the surgeries. And because of that, I have a long life chronic disease called short bowel syndrome. And it literally affects me every day. Every single day, life is different because of it, okay? And finding a gastroenterologist that actually believed me was everything. Before I actually found someone, I found so many gastros who were like basically blowing me off, trying to put me on, blockers and all these things that would not work for me and were harmful to my kidneys and all these other things. So I was like, you know what? I added Dr. Solomon David to your list last night. So Queens, New York, he's in there. And I was like, because we need doctors who care.
Yeah.
We need
it's already hard enough going to the doctor. I just want to say that.
It is.
Like, you need to go. A lot of people will avoid, and it does take time out of, and sometimes we just also are like, I feel okay, I'm not going to go until something's wrong. But if you had...
because of fear.
Yeah,
right.
It is fear. Yeah. And it is also because if you had a clinician who you felt like they care about me,
I'd be like, let me go talk to.
A pleasant experience. If something's wrong, I feel comfortable that they're going to listen to what it is that I have to say, and that they're going to make sure I know what I need to be doing. Like, that's important. It's a relief when you leave.
Right. It's huge. It gives you that extra step, because how many people have just decided decided I'm not going to go exactly what you mentioned because it's going to be a waste of time, or I'm going to be said or told things that aren't really helpful at all. Like, oh, just go exercise, or you just need to lose weight. I've had a lot of patients who have reached out to me on Instagram, and they'll say, I've been told for the 5th time that all of my symptoms are due to my weight, and I know it isn't. I need to find someone who will listen. And then they find someone on the list, and they finally have those answers. So if you can go into your doctor's appointment not only feeling like, okay, I'm going to have the chance to get forward what's been happening in my life and be listened to, that's huge.
And I think the other thing is that many people are not diagnosed until things are too late because they feel afraid of going to the doctor. And because of that, there are a lot of disparities that are, high levels in terms of cases of cancer being diagnosed much later. Fibroids, we see it all the time in fibroids because women are being told hysterectomy is their only option, or because they're being told that their pain, their heavy bleeding, all of that is normal. So instead of saying, no, let's see what it is. Oh, wait a minute. Let's look at your D3 levels because science has shown us that that's a major driver as to, fibroids. And no, they're not being given that care. And because of that, it becomes worse when we're disproportionate. Our numbers are disproportionate because of it.
Absolutely. When you think of heart disease, kidney disease, there's something else that I've been advocating for when it comes to blood pressure. This, I don't know if you guys...
Yes, I saw that.
You saw what I've been... For 15 years, I've been
right? Of meds
two classes.
For people,
and
Black
so
people.
Anyone listening right now, if you are on blood pressure, I guarantee you're probably, if you are Black, you're on either a calcium channel blocker or a thiazide. Those are 2 classes
what are
of high blood pressure medications.
Because they may not only know them by names.
So think of hydrochlorothiazide or a calcium channel blocker like metoprolol. And so what has been recommended is if you are Black and you have high blood pressure, the recommendation is that you should have one of 2 of these classes of high blood pressure medication just based on the color of your skin. Well, that has been debunked and it shouldn't be happening, but it's still happening every day. Our organs are the same. And also, let's just take a step back. Let's talk about other options as well, not just medications.
Hello.
And so that part is huge. And so I share with people, if a doctor says, oh, I'm going to put you on this high blood pressure medication, ask, why did you choose this medication? Help me understand what your decision behind this. Because if you hear, and these are my red flags that I call it, the implicit red flags, because you're Black, because you're of your weight, because of your age, that doctor may not be the right doctor for you because they are not taking in you as an individual. And that's the way medicine should be. It should be personalized.
And you've also talked about how sometimes people are grouped by, WW, TW.
Oh, please go into that.
Can you break that down for us?
I was a TW and a WW, according to them.
Yes, and I am. I'm probably as well. And I think, Angela, that kind of goes
girl.
back to
we got the club.
And I think that's because being a patient and a doctor, but sharing like my journey with lupus, which is an autoimmune, all of our conditions. And so in medical school, and it's still happening, I remember hearing the term WW. And a lot of other doctors have talked about it. And it's considered to be, it's called whiny women. And it is associated with multiple conditions, meaning you are just anxious, you're nervous, all the things other than an actual condition. And the other term is TW, train wreck. So imagine if you have an autoimmune disease, God forbid you have another condition like high blood pressure or something else, and you go into the doctor and you need help. Well, your doctor may write TW as like a train wreck, or may say that to the medical students or residents. And it's a label that prevents you from being able to get the care as far as what could that differential diagnosis be? What could that running list be, instead of this association and label? I'm going to give you another one that I did a video about as well. The 4 Fs. And this one is still live today. So fat, fertile, 40, female. In medical school, PA school, nurse practitioner school, if you fit those 4 categories, meaning you are 40 years old, you are considered overweight, you're female, the diagnosis would be a gallbladder issue. So if you come in, you've had stomach pain, you're 40, you're female, and you are overweight, the first thing I'm going to think of is maybe you have a gallbladder issue versus anything else. And that's a mnemonic.
So many other
Fs.
things.
It could be
It could be so many different things. And
fibroids Cancer's on the list. Put the other F.
Yeah. Fibroids. But those associations, instead of saying, okay, let's go through the symptoms that my patient is sharing with me, let's find out all of the things that it could be.
Yeah, that bias is going to get them to miss what's really happening.
Exactly. And that goes into why we have the disparities that we have.
You know, this makes me think about what I shared with you about the four, my 3 laws for exceptional patient care. This is, and this happened, you know, I came up with it after my whole brain aneurysm thing, Angela. And it was that, you know, if we will just listen to what our BAE, I say listen to your BAE, which is your body, your advocates, and your experts, right? Listening to your body, because number 1 is pain is a warning sign. It doesn't matter. If you have pain, that is your body telling you something is wrong, and you should not and not dismiss it and not ignore it and speak to a doctor until you find the right one that is actually helping you address what is causing it. That's number 1, right? So that means if they're not listening, you need another doctor. Don't let somebody just send you home and it's never resolved, because pain is a warning sign. If you don't listen to what I said, if you don't listen to the whisper, it's going to become a scream. A whisper can be elevated blood pressure, where the scream is a heart attack, right? So that was body. A is advocates. Medical bias is real. We have literally broken that down.
Yeah.
So you need, not you just should, but you need an advocate in the room with you, whether it's on the phone, on FaceTime, physically with you, because as she talked about how you can be vulnerable when you're in pain and you're dealing, there's so many things we miss because we're vulnerable. So, you know, have people with you who either on the phone, someone with you who can ask questions who you may not be hearing, because medical, it's really real, right? And then the last one is the experts, and this is really important. When you go into the physician's office, there are 2 experts in the room at all times. There is the physician, who is the expert in their whatever specialty is, and there's you, who you're the expert on yourself, right? So if you are dealing with a doctor who dismisses your expertise, because the truth is, you are the biggest clue and source of information to finding out what's really wrong, right? So if they are not validating and listening to your expertise, they're not the right doctor. Period.
Yep. They do not deserve your care.
No.
And I go, so
that's why I love
always,
clinicians who care, because I vote with my feet. I go to doctors who care.
Right. Well, and I like to paint the picture of you are at the doctor and your doctor is dismissing you. You know that you're being gaslit. And to your point, sticking with this is happening. So I tell my patients, I'm like, do not doubt yourself, because when you are experiencing that and you are feeling it, it is real. And then the second thing is leading with that curiosity language, because you need to find out, where is that doctor? Is that doctor going to be able to meet you where you are, or are they not? And then the third thing that people don't talk about is you can ask for a different doctor. You can fire that doctor. If you are in the situation, like we know the viral videos that have been happening that we've seen with the 3 women, you can ask for a different nurse. You can ask for someone else.
Yes.
And the fourth thing that you can do, and this depends upon your situation, but you can be transferred to another hospital. And a lot of times people don't know that if you are not getting the care you need, you can be transferred. And then the fifth thing is, in that moment, if all things aren't working for you and you know that you're not getting the care that you need, I say record. I say, making sure whatever you need to do to have a witness with you in that room is huge. And not everybody can bring someone, but if you can record, and sometimes just saying that, all of a sudden they dance.
Let me
to
get
a
on
different
point.
beat. And then the last one that I talk about that I think people often don't realize is, you can say, can you document in my chart that you have decided not to give me this care? Can you document that you've decided that we do not need the extra steps? Now, I give that ladder because it helps you kind of give a framework for what you can do in the beginning as you work your way down.
Right.
But everyone's situation is different, but this at least gives you a plan. The other thing that can be helpful is a medical playbook. And I love this. I have one for myself, and it allows you to track your symptoms. It allows you to track what doctors have said certain things to you. And that way, when you see a doctor and they're like, well, we're going to do this test, and you can show, oh, I've already checked my blood count. I've already done this. What is next?
Right.
And so I have that free. I have a free.
That's a
my
great
whole
guide.
point is like, let me give you everything so you can go on my site.
No,
You can
that's
see it. It's
great.
a free medical playbook. And the other thing that's important, I've got a lot, is before your doctor's appointment, I want you to write down your top 3 concerns. And so you're going to start with those. And because most doctor's appointments, you've got about 15 minutes
Yeah,
with
true.
that doctor. And before you go in, you're going to practice with those 3 C's of what you want to say. And so when you go in, you're prepared to start with those top 3.
So you don't feel rushed.
You
Like, I got to
don't
get out
feel
of here.
rushed.
The doctor's got to go. Yeah.
Right. And you start with, I know we've got about 15 minutes, but these are the top 3 pressing issues that I'd like to talk about. And then you lead with, what is the next plan? So that's what you do in that 15 minutes, because realistically, that's what most people are facing when they see their doctor.
You know, Dr. Bayo, you are definitely a clinician who cares. I can tell
Yes.
just by this platform that you've created, but also how passionate you are when you talk about everything. So I can't even imagine, you know, just the help that you've given to people. And I know that's your mission with this. Yes. So, and we can feel it in this room. So I appreciate you and thank you, because I know you have a lot going on. But the fact that you took time to come out here to talk to our audience on this platform does mean a lot to us as well.
Thank you for having me. And it is like the warmth that I feel in this room is
I love,
fantastic. And
I learned a lot, let me tell you.
Let me know if I can help in any further. I'm like, this is my love and passion, just to share health as widely as possible, because we all consume information differently. And for the doctors who are still, you know, of course, give that care in the room, but people are hungry for more information. And for me, if I can help you online, if I can help you through any sort of medium where you get that information in a free format, that fills my soul.
Yeah.
And I tell my medical students and residents, I'm like, it is such a gift to be a part of people's most intimate lives. And you need to cherish that.
Yes.
And that's what I think of every time I walk into a patient's room. Like, what can I help them with? What can I serve them with? And I think that is another thing that we need to embed into our culture, because healthcare has lost that narrative. And that's where that heartbeat is supposed to be when it comes to delivering care. So thank you for having me here. Thank you for the opportunity to reach more people. I am grateful.
And please add if you have an amazing experience,
Yes.
please add
Clinicians2care.com.
that professional. You have a book coming out too?
I do. And so the book will be live January 2027.
Okay.
The working title is How to Talk to Your Doctor.
Love that. All of this is going to be in book form.
And the wonderful part that I'm very excited about is, as a family medicine doctor, I work in all areas of health. So this can help you whether you're, emergency room, whether you are going for surgery, any part. And it can help you stand up for yourself in those moments, but also if you're a caregiver, because a lot of us, 80% of women, are the caregiver, and it will help you have the language to advocate not only for your loved one, but for yourself.
Okay.
Phenomenal.
Perfect. Well, thank you so much. We appreciate you for coming through. This was amazing
you.
and eye-opening for a lot of
You
us.
are saving lives.
Thank you. Thank you for having me.